Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about sternocleidomastoid. So if you see sternocleidomastoid, it is, so I'm just first draw the skull and this is the mastoid process. And here we have a clavicle and here we have the sternum. Now the sternocleidomastoid takes its origin from the mastoid process, that to lateral surface of the mastoid. First it takes its origin from the sternal head by a rounded tendon, and it also takes its origin from the medial 1/3 of the clavicle. This part of the sternocleidomastoid which takes its origin from the sternum is called as sternal head, and this part which takes its origin from the clavicle is called as clavicular head. The sternal head and clavicular head, both these will combine together, and both of them are inserted into the mastoid, which is a site of insertion. So mastoid, and also it gets inserted as a thin aponeurosis into the lateral half of superior nuchal line. So if you see the origin of the sternocleidomastoid, it occurs in the clavicle through the clavicular head, and on the sternum through the sternal head, and it gets inserted into the mastoid process. So if you see the actions, this help us to move the head. That is this is the muscle which helps us to tilt the head on the same side. That is, if this is the face, if this is the face and this is the person, now this helps in tilting the head to the same side. This sternocleidomastoid will help in tilting the head to the same side, and it rotates the head so that the chin turns to the opposite side. So what are the relations of this sternocleidomastoid? About the sternocleidomastoid, it is related to skin, platysma, and in the skin we also have some cutaneous nerves which are present over the sternocleidomastoid, like we have greater auricular nerve, transverse cervical nerve, medial supraclavicular nerve, and lesser occipital nerve. And you will also see the external jugular vein which runs over it. Okay, so these are the structures which you see about the sternocleidomastoid. Then what about the supply, blood supply of sternocleidomastoid? So if you first see the blood supply, the arterial supply, the upper part is supplied by one artery, second 3 arteries. So if you see the upper part is mainly supplied by occipital artery and the posterior auricular artery. The upper 1/3 is supplied by occipital artery and posterior auricular artery, whereas the middle 1/3 is supplied by superior thyroid artery, whereas the lower 1/3 is supplied by suprascapular artery. And if we see the nerves, sternocleidomastoid is supplied by mainly the spinal accessory nerve, and it is also supplied by ventral rami of C2 and C3. So this is about sternocleidomastoid. Thank you guys for watching my lecture. Thank you.
Thank you, and thank you for watching.